Welcome again. My name is Singh, and I'm with CanSAGE, the Canadian Society for the Advancement of Gynecologic Excellence. One thing we often forget about when we think about surgeons and physicians is their own well-being. We're so busy taking care of others that we forget about our own health. Dr. Jane Lemaire is here with me, who is a Vice Chair in Physician Wellness and Vitality in the Department of Medicine at the University of Calgary, and she's also a clinical professor. Thank you for joining us.
You're welcome. It's my pleasure.
Now, you just did a fantastic talk that was very emotional because it hit home with a lot of surgeons who are struggling delivering care, but also dealing with taking care of themselves. Why is this important for physicians?
I think the work that we do is very stressful, and there's very good science to support that one of the occupational hazards or work-related hazards that we face as physicians is actually burnout. And that's a psychological, emotional hazard that results from chronic workplace stress. And burnout's been well studied, well documented. It's prevalent. Some people even call it an epidemic. If you weren't a physician, you wouldn't have burnout to the degree that you do. So it's because of the work that we do. And that burnout has both personal and professional consequences. For the physicians, they're at risk of more anxiety, depression, suicide, substance abuse issues, relationship difficulties. It has some very serious personal consequences. And then the professional consequences of those physicians being in the workplace is also pretty evident. In fact, we published a paper suggesting that physician wellness should be a quality indicator because burned out physicians spend less time with patients, they order more unnecessary tests, they tend to have riskier prescribing profiles, and patients of burned out doctors tend to sense that the physicians are burned out and are less likely to adhere to the advice that the doctor gives them.
Now, during your presentation, you had a lot of advice for colleagues. Can you share with us what I can do or what you'd suggest our colleagues can do to improve their situation and reduce burnout?
So through research around burnout, we know that there are several factors that contribute to burnout. So there are individual factors, there are factors around the medical profession, and there are factors around the health systems that we work in. And so all three of those factors will contribute to burnout, and so the solutions have to come from all three places. So for example, physicians can have some personality types that make them quite driven and want to be invincible and perfect, and that's not achievable. So we, as professionals, have to learn to mitigate our stress and be cognizant of some of our personality traits that may not help us stay well. From a medical profession perspective, there are toxic aspects of our profession where we valorize certain behaviors as a sign of commitment, working long hours, not taking a break, etc., etc. And I think we need to shift that culture and actually advocate for wellness and promote wellness and role model it. And within the health systems, often they falter. For example, there's no place to get healthy food after hours, or there's no quiet place to regroup when you're having a very busy, chaotic day. And I think that the health systems also need to establish some system-level interventions that allow us to stay well within this very challenging profession.
We really appreciate all that you've done to advocate for physician health and for sharing this with our membership. Thank you very much.
You're quite welcome.